Moriyama, vamos a tener un cambio en el orden de las conferencias. Doctor va a continuar con su siguiente presentación, Bridging the Gap, telemedicina para endoscopia de alta calidad. Y posteriormente seguirá la doctora Sandra Cifuentes. Luego de terminado ya este segmento, los invitamos al simposio almuerzo con el tema de relevancia del endoscopista en el diagnóstico oportuno del cáncer gástrico. Gracias.
Okay, sorry for my continuous talking. Okay, so my last talk is how to motivate yourself or how to learn those kind of techniques or how to get the newest knowledge about procedures or observation or something. So, right. Okay, so now I'm the chair of the Telemedicine Development Center of Asia at Kyushu University Hospital. So I always use a telemedicine. So, but there is two types of telemedicine. One is doctor to patient. This is just like online consultation from patient, mainly used during the COVID, I suppose. But we are the university hospital people, and we are more focusing on doctor-to-doctor education, telemedicine, right? So teleconsultation from patient is quite good to take care of those kind of people living in rural areas, but the number of the patient can be treated is very limited. But once we organize a D2D, doctor-to-doctor telemedicine, so we can develop an expert in various places, and then each of them can save their patient lives. So it's quite important to connect the doctors in the world, I think. So, as you know, now is quite important to tackle with non-communicable diseases, NCD. So that now we are moving to the hyper-aging society. So that increased life expectancy due to improved management of infectious diseases, NCD's importance of NCD is bigger and bigger, but still not so good, measurement is not developed in various countries. So, and this is the typical part is cancer, right? Cancer is a kind of the disease for elders, right? So this is a number of cancer deaths in the world, still growing. And the top is lung cancer, followed by colorectal, liver, stomach, breast, and esophagus, just like this. So that we endoscopists should work more harder, actually, to save those kind of patients' lives. Okay, just like this. This is a trend of GI cancers in Colombia for the next quarter century. So as you can see, in this colon, stomach, esophagus, all these cancer will increase. So this is Asia's incidence of gastric cancer and colorectal cancer. Okay, this I already showed this figure. As you can see, our country is a very high risk country for GI cancers, just like this. But compared to its incidence, mortality is lower. So we can do an early detection and minimal invasive therapy by endoscopy. Okay, so as I already showed, okay, we have a very good healthcare system, and also we have the culture to share, sharing the knowledge and the experience among people. Okay, so educate. I think I'm a university people, so that's why I always emphasize the importance of education, how to educate young doctors and how to motivate them to learn more. So that we have a lot of opportunity to organize the education system. The left top is a small meeting, almost held every day. The center top, all endoscopic pictures taken by young fellow will be checked by all the experts. And left bottom is a cutting edge simulator, and we sometimes organize our training. The peak stomach using the peak model or something like that. just like that, for ESD. And we have accepted many trainees from various countries and already showed, okay. All right, this is a number of trainees from Latin countries in our hospital. So Brazil is the top, for the Mexico, Chile, Colombia, and Peru. Okay, so that your country is one of the how to say, right? It's really, we have a very good collaboration between us for long. Okay, so I suppose in training, the on-site is the best, I think, because we can share the technique and hand by hand or something. So, but it's unsustainable, right? So we need a cost and also time, both for trainers and trainees. And actually, the doctors who can do such kind of training is quite limited. So that's why we started the telemedicine since around 2003. So we can connect just like that all over the world. So I myself, the endoscopist. So that's why the most active area is endoscopy. So we organize 1, 2, 3, 4, 5 regular telemedicine program with various countries. The most oldest one is China, Japan Early Gastric Cancer Teleconference, but second oldest one is Latin Conference on the endoscopy, started in 2013. Okay, just like this. This is a screenshot of our teleconference with Latin countries. Okay, connecting various countries in Latin America and also some institutions from Japan. Okay, so I suppose the most popular telemedicine is webinar. This is a sharing. This is a the seminar from the expert to novices or other endoscopists. This is a Chile, Mexico, Japan. Uedo Sensei, Yao Sensei from Japan. Okay, this is a so using this kind of voting system, we accelerate the discussion during the telemedicine. It's from Brazil. I look younger, right? Okay, so as I mentioned, we started this activities from 2013. Okay, just like this, these are the topics of each teleconference, just like this. But we change the contents of this conference from 2019, from webinar to case discussion. Because we can accumulate the knowledge by reading text, here, and also internet, right? But we need experience, right, to get a correct diagnosis. So that's why we change the content to the case discussion just like this, right? Okay, so at that time, it is important to have pathologists there. If possible, surgeon also, right? So that we always have a diagnosis based on endoscopic findings. And sometimes send those patients to the surgery. But without any feedback from pathologist, we cannot understand our diagnosis is correct or not. It's quite important. We can learn only from mistake, right? More impressive to us. So that's why it's quite important to have pathologists in our discussions. Okay, this is just one question to you. Okay, what is the diagnosis? This is a white light and this is NBI. Okay. Okay, the adenoma. Please raise your hands. High-grade dysplasia. Oh, no one. Submucosal invaded adenocarcinoma. Okay, so you will send the patient to surgery, right? Okay, so malignant lymphoma? No? Hemangioma or lymphangioma? Oh, you're too shy, right? Like Japanese. Okay, right. The answer is pyogenic granuloma, quite unusual case, right? It's quite unusual, right? Rare, I can say. But in daily practice, I suppose that you will not meet such cases, right? Even for me. But joining this kind of conference, we can see the many rare cases. That's quite important to accumulate our experiences that make our diagnosis more precisely, right? Okay, so we endoscopists should accumulate knowledge and experiences. But other than that, also we should establish our techniques, right? So it can be covered by live demonstration or such kind of activities, okay? So to know the technique of expert, this kind of lab demonstration, conventional lab demonstration is quite popular. In that cases, sometimes, not sometimes, always, they invite the guests, faculty, and I myself sometimes go abroad and do some procedures in the hospital, close to the venue. It's good to learn, but we should perform various procedures in total different atmosphere. Of course, staff is different. Endoscopy room is different from ours. Sometimes some equipment is unavailable in some places. And indication is also different. And we cannot take care of patient after treatment because then I should go back to my home after procedures. And sometimes we feel language barriers and sometimes jet lag, right? Because I'm living in the opposite, right? And for organizers, they should prepare lots of patients, and also they should submit a paper to the government or states to get a tentative medical licenses for them. So that's why we do organize a remote live demonstration like this. This was in 2017. We connect the main various institutions from those countries to main venue in Japan. Okay, this is a live demo from Japan to Mexico in 2017. Sorry, no audio. All right, this is a live demo from Japan to Mexico about ESD. The Uedo sensei explained about the new endoscopy. Yes. And he showed the ESD, gastric ESD from Japan to Mexico, right? Very smooth. Even though we are living the opposite, right? This is a chronic ESD from Kyoto, Yoshida sensei. Okay, just like this, and then we can, right, okay, all right. So nowadays, it's quite easy to connect medical institutions regardless of the distance, right? Okay, so these are the feedbacks from the participants on telemedicine. Almost satisfied in quality or the image movement, sound, or something like that. Okay, so the change, everything has changed after the pandemic, right? So it's quite tough. It was tough situation for us, but from the viewpoint of telemedicine, everything is moving to the good direction for us. During the COVID, we organized an international teleconference on COVID. 3 times, just the beginning of the COVID, like March, May, August in 2020, right? So at that time, the COVID is just diseases for Asian people. So but we connected various countries and we did a discussion how to tackle with this disease and how to protect medical staff from these new diseases. Okay, so, and at that time we organized a telemedicine with Latin countries, and most of them joined from their home. Before that, they only can join from their institutions because they need engineer to connect each other. But nowadays, only we have to just one click, right? And also, the internet situation has been dramatically changing. This is the top is Bhutan, left bottom is Myanmar, right bottom is Kenya. Before the pandemic, we tried to connect these countries to invite to our telemedicine, but doesn't work well actually, because the internet situation is too bad to get good quality images and movement. But during the COVID, it's quite easy and to connect and to get the good quality. And about the live demonstration, before the pandemic, we should prepare a lot of engineers and with complicated systems just like this. But nowadays, the write-up, this is a live demo from National Cancer Center to Russia. We supported it technically. The guys sitting on the right top, that is not the engineer. He's medical doctor. So quite familiar with IT. So, but using his own PC, its live demo is quite easy to do, right? So that means usually live demonstration will be done from expert to novices, but reverse telemedicine, live demo from novices to expert is available now, right? Because setting is quite easy, right? This is a remote instruction from Australia to Palau, right? Just like this, that we can send the images quite easily and with operator's hand view, so that they will have some advices during the endoscopy from Australia. And same can be happen in Japan. This is a surgery instruction from Hokkaido to Fukuoka, our city, our university hospital. Actually, that expert is 1,400 kilometers away from the hospital, but they can do some remote instruction to our young surgeon. And this is the international ones. This is just started with Kenya, right? This is between Japan and Kenya. Endoscopy images are sent from Kenya to Japan, and I can make some comments or instruction to them during the endoscopy. And nowadays we can do such kind of education, and we can share our knowledge and experience with various kind of people, regardless of the distance. It's quite good era for us. So this is okay. So as I mentioned, we organize at Latin American Endoscopy Teleconference regularly. So next one is this month, right? 25th, Wednesday at 6 p.m. in Colombia. I suppose it's good to join. I suppose you guys already finished their daily work. So next time, from Japan side, we will present 2 cases. One from Kindai University, the one from Osaka, Uedo Sensei will make a presentation about interesting case, I suppose. So why don't you join us? Okay. So this is the last message from me. Telemedicine is useful for sustainable medical education. During and after the pandemic, telemedicine has become popular and casual, right? So telemedicine can contribute to filling local, regional, and global medical gaps. Thank you for your attention.
Thank you, Dr. Moriyama.